Good afternoon. My name is Amal Nirgudkar. I'm the CEO of Patient Prism, and I have one of my favorite people here, Amber Collins from Pink Dental, and she's their Vice President of Operations. Lately, I've heard Amber speak at all these conferences and really rock it on stage, and I'm really excited to have you and talk to you about uh, the patient experience that you focus on. Right, Peak focuses a lot, not just focuses, but actually implements an amazing way to wow patients. Right, because at the heart of even what we do is delivering exceptional patient experience can transform your practice. So how do you guys do it?
Yeah, that's really what defines our company as our patient experience. And so, what we do is at the core of all of our training is we implement what we want that patient experience to look like. We have a dedicated training to just patient experience. It's
Okay.
a full day that all of our employees have to go through. It's required.
Okay.
And so, yeah, I think everybody can talk about, hey, it's all about the patient. We want to give them quality care and the best care, but it's also about their experience and
Right.
just making sure that that is the center of our focus every single day.
So is that like codified in terms of what each team member does in terms of delivering that experience?
It's so hard to codify something like that.
Right.
It's not very tangible. And
Right.
so putting together the training was probably one of the hardest things that we have done.
Right.
However, we do have kind of set protocols of like what to say, what should you not say,
Sure.
in front of a patient, and what should the atmosphere feel like or look like, smell like, things like that. Just the little details that really matter when a patient walks into the building and then when they walk out. What should they hear, see, feel, smell?
But you've got to kind of talk to like the hygienist differently than the office managers differently because they have different conversations, right?
Yes.
With patients. But I'm really interested in because you implement this amazing score called the Net Promoter Score in your organization. How do you use that?
So your Net Promoter Score, your NPS, is based off of one question, which is how likely are you to refer your friends or family to us?
Sure.
And so we really track it by office and we track it at a company level.
Okay.
And we are very diligent about what are the comments that are being left? Why are
Sure.
people not coming back? That's something that we're constantly tracking. And then, if there is something that we can work on, which there's always something,
Right.
that's when we're leaning in and focusing on the patient experience.
So are each office you measure each office score, and then you compare which office has the best score, or is it employee driven? How does it logistically work?
It's driven by each office,
Okay.
and so we will post, hey, these are our NPS by office, and we really care about what it is at a company level.
Sure.
But when we're diving in and really focusing on the patient experience and what could be better, that's when we're looking more at the office level and seeing, okay, what could be better? Is it the front office? Is it the experience in back? What
Sure.
can we do?
And then are employees incentivized to deliver a better patient experience?
Yes, so we do have a lot of our bonus structures for all of our employees are based on either NPS or overall satisfaction of the patient.
So in terms of actual implementation, like is there somebody who's observing people at the office level of how they're interacting with the patient? Is there observation going on?
Yes, absolutely. So we do secret shoppers, actually.
nice.
So they'll not only shop our practices, but they'll shop competitors as well.
nice.
And so we will get a report back from that secret shopper. We don't know who they are. We don't know
Sure.
when they're coming in. It's 3 pages that they have to fill out just based on what we've put together is
Sure.
our standard for the patient experience.
So it's interesting, Sen. And have you seen tangible results with offices that have better patient experience? Do they have a higher case acceptance rate? Do they have better patient counts? What have you seen in terms of actual measuring? Because I know you guys measure a lot.
We do. Yes. So we have seen higher new patient counts, specifically internal referrals
Wow.
from other patients.
Absolutely.
We do see higher productivity in our doctors because they have higher case acceptance.
Sure.
And then we will track what we call our schedule rate, but it's really more of a loyalty rate. So it's, how many patients are actually coming back to see us.
Absolutely.
And typically the offices that have a higher NPS are directly correlated with all of those statistics.
Oh wow! So there is a direct correlation between patient satisfaction and higher revenue,
Absolutely.
patient satisfaction and employee satisfaction,
Yes.
right?
Yep.
And the doctors are happier because when more patients accept the treatment, they're making more money.
Absolutely. Yep.
How do you when you buy a new there's a new acquisition? How long does it take for you to integrate this in their ecosystem?
So we have everybody go through all of our trainings and specifically patient experience training within the first 90 to 120 days. We
Sure.
try to do it within that first 3 months.
Okay.
And we really focus on the patient experience day one. And that's what's most important. We can fix systems and protocols and make things better, but if we're taking care of our patients and treating them right, then we're automatically growing that business.
Absolutely. And this is so fascinating because I think the DSOs that really focus, or dental practices that focus on this, are going to continue to outperform. And one of the reasons why you outperform everybody else in the business is, I
Right.
think, this focus. And I'm truly excited. I can't wait to visit one of your offices and to actually see, even as a patient, just come there for a cleaning and say,
Right.
how does it feel? Thank you so much for this talk.
Yeah, thank you,
I appreciate
Amal. Thank you.